Welcome to our channel. Today we're diving into some of the most shocking medical mistakes that actually happened. You won't believe these true stories. We put so much trust in medical professionals to take care of us when we're sick or injured. But as humans, even the most skilled doctors and nurses can make mistakes, and sometimes those mistakes can have devastating consequences. In this video, we'll explore 5 cases of unbelievable medical blunders that will leave you speechless. These stories are a stark reminder that medical errors can happen to anyone, anywhere. And that's why it's so important to advocate for ourselves and our loved ones in a healthcare setting. Get ready to be shocked! Imagine going in for brain surgery, a procedure so delicate, so intricate, it requires the steadiest hand and the sharpest mind. You're prepped, the surgery begins, and the surgeon meticulously navigates the complex landscape of your brain, but then the unthinkable happens. The surgeon, after successfully completing the operation, makes a chilling discovery. They operated on the wrong side of the brain. How can this happen, you might ask? It seems unfathomable, a mistake straight out of a horror movie. But sadly, it's a reality for some patients. In the chaos of the operating room with its complex procedures and high stakes, even the most experienced surgeons can fall prey to human error. A heart transplant, a surgery that symbolizes hope, a second chance at life for those with failing hearts. But what happens when this beacon of hope turns into a nightmare? Picture this, a patient filled with anxiety and anticipation finally receives the call they've been waiting for. A matching heart is available. The surgery is a success and hope blossoms as the patient recovers, but that hope is tragically cut short. The patient's body begins to reject the new heart. Tests are run and the unthinkable is revealed. The transplanted heart was the wrong blood type, a fatal mismatch that cost a life, a mistake that should never happen. Chapter 3. In the quiet halls of a hospital, amidst the beeping machines and hushed whispers, a nurse prepares medication for their patient. A routine task, done countless times before. But this time something goes terribly wrong. A misplaced decimal, a momentary lapse in judgment, and a lethal dose of medication is administered. The patient, already vulnerable and fighting for their health, suffers a fatal overdose at the hands of those meant to heal. This chilling scenario underscores the immense responsibility healthcare workers carry and the devastating consequences of even the smallest mistakes. Chapter 4. The operating room, a place of intense focus and precision. Surgeons work tirelessly, their every move calculated, their instruments an extension of their expertise. The surgery is complete, the patient stitched up, wheeled into recovery. But something is terribly wrong. Days, maybe weeks later, the patient complains of excruciating pain, their condition deteriorating. Scans reveal a shocking truth, a surgical tool left behind amidst the sutures and incisions. A scalpel, a clamp, a sponge, an unwelcome souvenir from a surgery gone wrong. This terrifying scenario highlights the importance of surgical checklists and rigorous post-operative procedures, measures put in place to prevent such unthinkable errors. Chapter 5. Imagine receiving a life-altering diagnosis. A terminal illness with a grim prognosis. The news hits you like a ton of bricks, stealing your breath and shaking you to your core. You grapple with the weight of your mortality, the precious time slipping away. But then, a glimmer of hope, a second opinion, a review of your medical records, and the truth emerges. A misdiagnosis. The illness you were told would claim your life was a mistake, a misinterpretation of tests, a failure to consider all possibilities. The relief is immense, but it's quickly overshadowed by the realization of the unnecessary fear and potentially harmful treatments you endured. Thanks for watching. If you found these stories as shocking as we did, make sure to like, comment, and subscribe for more eye-opening content. Stay safe and healthy. These stories serve as a stark reminder of the importance of patient advocacy. Don't be afraid to ask questions, seek second opinions, and be an active participant in your own healthcare. Knowledge is power, and in matters of health, it can be life-saving. Remember, medical errors can happen, but by being informed and proactive, we can minimize risks and strive for the best possible outcomes. Until next time, stay healthy and stay vigilant.